You're in chronic pain. You've tried therapy. You've tried physical therapy. You've tried chiropractic. You've tried injections. You've even tried surgery, and you're still in pain. It's not your fault. You just never had the right kind of care. Let's fix that. Don't miss this episode.
Welcome to the Defeating Pain podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
Welcome to the Defeating Pain podcast. I'm Dr. Ted Arkfeld, and in each episode, I'll show you a smarter, faster, and more effective path to defeating chronic pain by focusing on the real cause and not just the symptoms. So if you're tired of not getting any relief or temporary fixes, you're in the right place. Let's be honest. Most people with chronic pain, they've been through the system. They have been through chiropractic care. They've been through physical therapy. They've been through spinal injections. They maybe even had surgery, and yet they're still in pain. Why? Why are you still in pain when the predictable amount of time for healing has occurred for whatever tissue was injured? What do I mean by that? We know that when you fracture a bone, you're looking at about 6 to 8 weeks for healing time. We know that when a disc herniates or ruptures, that the disc will self-seal and heal in about 90 days. So what happens when the normal predictable healing time has come and gone and you're still in pain? Well, it's now turned from a structural or a mechanical problem or an orthopedic problem to a neurological one. So traditional pain treatments, quite honestly, are stuck in an old model. They're treating only the anatomy, muscles, joints, and bones. And this rarely addresses the neurological issues. The neurology, or neuro rehab, as I call it, centers around the brain, the nerves, the input and output signals that control everything. So if you don't fix the neurological side of the problem, the pain always finds a way to come back, or it never gets better. That's the reason in our clinic we see a lot of post-surgical patients. They've gone to their orthopedic surgeon months after the surgery and they're still in pain. They've had 6 to 8 weeks of physical therapy. They're still in pain. They've had spinal injections, still in pain. And they go back to each one of these providers and they say, why am I still in pain? And they get the same response. Well, we don't really know. The surgery was good. We got rid of the bad anatomy. Well, your range of motion seems to be pretty decent. Your strength is pretty decent. We really don't know why you're still in pain. It's because they've been looking at it from an orthopedic standpoint and not a neurological one. And that's why we get results where others have failed. So at Arkfeld Advanced Chiropractic, we don't just treat the bones and muscles, we treat the entire nervous system. See, I grew up in a chronic pain family. My father was like that. And I'm here to tell you, you don't have to live that way. I don't care if you're not in Michigan. Okay, you can schedule a virtual consultation with me and or if you are in Michigan, schedule an in-person consultation or a virtual. It's no charge. I want to talk to you and let's find out if we can't get the right approach wherever you're at so that you can get out of pain as well. If not totally out of pain, at least reduce down so you can start enjoying life. Let's say that you're living with a pain scale of a 7 or 8 every day. If we can reduce that by 50%, that'd be a clinical success story. I'm sure you'd be happy. Well, the only way you're going to find out if we can do that, you got to get in touch with me. You can call the office at 989-448-8065, or you can go onto our website. Go onto our website. I believe the email is info@arkfeldchiropractic.com, or call and let's get virtual consultation scheduled for you as soon as possible. I just want you to know that the only thing you really have to lose is the pain. So if you don't schedule a consultation with me, if you just are afraid to get your hopes up, I can tell you that nothing's going to change and you're going to still be in pain. Don't do that. Give us a call.